I'm Charles Bankhead, reporting for MedPage Today from the San Antonio Breast Cancer Symposium. Adjuvant therapy with the bisphosphonate drug zoledronic acid did not improve progression-free or overall survival in patients with stages 2 and 3 breast cancer, according to results of a large randomized trial known as AZURE. Results of preclinical studies and one previous clinical trial had suggested that zoledronic acid might have anti-tumor activity in addition to bone preservation effects. Dr. Robert Coleman of the University of Sheffield in England discussed the AZURE findings during a news briefing at the meeting.
So let's now turn to efficacy. Firstly, the primary endpoint, which I'll remind you was disease-free survival. And you can see that there is no difference in this analysis of all patients with a hazard ratio of 0.98 and the confidence intervals clearly straddling 1. Very similar results are obtained when we use the invasive disease-free survival, which incorporates other events such as ipsilateral breast cancer recurrence, other tumors, and is a more sort of all-encompassing definition. But the results are the same. And if we look at the type of events, local regional recurrence, distal recurrence, deaths before as a first event, etc., you can see there is really no difference in this analysis of the study as a whole.
The results contradict those of the Austrian Breast Cancer Study Group trial, known as ABCSG12, which showed a significant improvement in outcomes among breast cancer patients who received adjuvant zoledronic acid. Dr. Coleman speculated about explanations for the two studies' different results.
This is our best estimate in terms of putting the AZURE patients, which would have been eligible for ABCSG12, alongside the ABCSG12 results. And you can see that they're chalk and cheese. There's a significant heterogeneity of results between the two study populations. So in AZURE, the estrogen receptor positive premenopausal women are showing no benefit. In fact, there's a non-significant disadvantage to zoledronic acid. And that's clearly different for ABCSG12. Now, the two groups are different in that in ABCSG12, all their patients received glycerin, so they were pushed into a menopause.
Although the overall trial results were negative, an analysis of 1,100 postmenopausal patients enrolled in the trial revealed significant survival benefits with adjuvant bisphosphonate therapy.
Now, we did some extensive subgroup analyses as planned based on minimization criteria, and one clearly stands out from all the others, and that is the treatment effect on disease-free survival according to menopausal status. So as you've seen in the previous slide, the young patients are getting no benefit. In fact, if anything, they're doing a little bit worse on the test drug. On the other hand, those women with established menopause, that means more than 5 years postmenopausal, or a few patients where we didn't know the menopausal status, but they were over 60, so one can assume they were postmenopausal, you can see that there's a clear benefit in that group. And the heterogeneity between those two populations, which is an important statistical test, shows a remarkable p-value of 0.001. This is rarely seen in subgroup analysis comparisons. If we look at overall survival, you can see that there is a 15% reduction in the risk of dying in the treatment in the trial as a whole, which does not quite reach statistical significance. However, when we look at these two menopausal subgroups, again we see a very different pattern emerging. In the younger patients, no difference in survival whatsoever. But in the older patients, the postmenopausal patients, a 29% reduction in the risk of dying of their disease, which is highly statistically significant.
In summarizing the results, Coleman elaborated on the potential reasons for the different outcomes in AZURE and ABCSG12.
So to conclude, adjuvant use of zoledronic acid did not improve disease-free survival in stage 2-3 breast cancer treated with adjuvant chemotherapy. In terms of the primary analysis, primary endpoint, this is a negative study. And it's highly unlikely that that overall conclusion will change with further follow-up. And we feel justified in introducing that second analysis so that we and patients can have a clearer idea about the role of this drug in the adjuvant setting. Having said that, Our results are strikingly different to those observed in ABCSG12, and we need to understand why. I don't believe one is right and one is wrong. I think we need to understand the biology as to why we're seeing this different outcome. And in pre-specified subset analyses, highly significant, extraordinary heterogeneity of effect by menopausal status was seen, with improved disease-free and overall survival in that important subgroup of patients, which actually constitutes half of breast cancer. And our hypothesis would be that adjuvant bisphosphonate efficacy is dependent on a low estrogen or inhibiting concentration within the bone microenvironment that we're seeing in our older patients and ABCSG12 induced by giving Visceralin.
From the San Antonio Breast Cancer Symposium, I'm Charles Bankhead, MedPage Today.